A very good evening, good morning, good afternoon to all the participants. Thank you very much for joining us. It's our pleasure. Um, Thank you to RewirEdX platform for creating this opportunity, a very meaningful and timely conversation on an issue that's in everyone's mind. The topic is extremely relevant: mental health and psychosocial well-being in all settings, at home, in schools, and in all settings. And we have had quite a few conversations on this issue, but I think there is a lot more space for discussions on what actions can follow. My name is Saji Thomas, and I'm the Chief Child Protection for UNICEF in the Gulf sub-region. I also have a special interest on this topic because I myself worked on mental health and psychosocial support at UNICEF headquarters for about 5 years. So a topic very close to my heart. I'm joined by an excellent panel today. I have people who have initiated the psychological first aid tool that almost all of us use in all settings. I have a MHPSS award winner joining us later in the, already in the panel. I have someone with over 13 years of experience in UNICEF in different settings. So an excellent panel, and I think it's going to be an excellent conversation. Just before I go to the topic, like I said, I worked on this issue for over 5 years at headquarters and throughout my career. But even now, when I look at some of the data, it is quite striking. It's staggering, and it's very true even for children, prior to COVID, and I'm sure it's equally true or even worse for a COVID time scenario. So we know that 1 in 5 children suffers from mental health disorder. We know that depression affects 240 million people globally. We know that half of mental health disorders begin before people are 14. So again, the weight on the issue. We know that 1 person dies from suicide every 40 seconds. So as we are speaking, and over the next 45 minutes, there'll be so many losses of lives just through suicide. We also know that the second leading cause of death among persons aged 15 to 29 is suicide, mental health related. So it's a serious issue. There was a lot of focus on it prior to COVID, but with COVID, it's become even more urgent. So it's going to be a very meaningful conversation, very relevant conversation. And, thank you all once again for joining us. The format is very simple. We have 3 speakers who will talk to their topics. And then I'm sure we'll have a few minutes, about 10 minutes or so for question and answers. So I really encourage you to go to the question and answer tab and then enter your questions and even comments, and we welcome all your contributions. So with that, let me introduce the first speaker, Leslie Snider, someone I know I have worked with in the past, a psychiatrist with over 20 years of experience in mental health and psychosocial support programs. She is currently the director of MHPSS Collaborative, an initiative by Save the Children. And like I said, she was instrumental in developing psychological first aid and its rollout, with WHO's support. It's a WHO initiative. She was also part of this community-based mental health and psychosocial support operational framework for UNICEF, something that we worked on together when I was at the headquarters. She has over 40 publications, someone who is just the right person to be giving us an overview of what psychosocial well-being and social determinants of well-being in mental health and psychosocial support. especially in an education setting. So over to you, Leslie. We look forward to listening.
Thank you very much, Saji. Am I on? You can hear me?
Yes, please proceed.
Okay, great. Thank you. It's really a pleasure to be here together with you, Saji, with Ananda and Stephanie. And I do applaud Rewired for recognizing the importance of a panel on MHPSS. And I wanted to talk about the scope of the problem just to start us off, and it not just from the current perspective, but also looking back prior to the pandemic and what the situation was for children, especially very vulnerable children. Because if we're going to build something better, I think we need to have that broader scope of experience and be able to really look at this issue of education and well-being from multiple angles and an integrated approach. And I'm also going to present some findings from a global survey that Save the Children has done called The Hidden Impacts of COVID on Children's Education. It includes a lot of data on well-being. And then I'm going to pose some questions that I am sure my fellow panelists will take forward in their presentations. So, you know, we've all heard the statistics in early April 2020 at the peak of the lockdowns. About 1.6 billion learners globally, 91% of the total, were out of education. And for the first time in human history, an entire generation of children have had their education disrupted. So COVID has affected all of us. But interestingly, it has also kind of raised an opening for us to talk about mental health. And because it's all of our lived experience at the moment. And I think that having these personal experiences has made the field infinitely more relevant in the global sphere, because we know what it is to have our children worry, not to see their friends, as parents to be juggling the myriad demands of homeschooling and working in new ways, for teachers to be navigating new ways of doing their jobs, and all of this in the midst of tremendous insecurity. So I do think that we are suddenly able to talk about these issues in a way that we didn't before. And just to look at the scope of the problem, 1.6 billion is a staggering number. And one could imagine that if they all return to school as society begins to adjust to a normal, then it's just a few months of lost learning. Teachers could catch them up. The long-term effects would be manageable. But no, not all of them will be able to do that. And even before this crisis, we had 258 million children out of school. Many more are unlikely to return because parents may not feel safe in sending the children back. The cost of fees may be too great with the economic crisis, or children might need to work to recover family incomes. And the education access for the 33 million refugee and displaced children was already in crisis. Only half of refugee children had access to primary education, and only 22% of adolescents to secondary education prior to the pandemic. I think statistics on violence are also critical, and particularly as this and other adverse child experiences can lead to toxic stress with potential long-lasting consequences for the developing child's brain, their ability to grow and learn and develop relationships, and particularly for their physical health. And too many of those who do return to school may actually not be learning. So prior to COVID, nearly half of the world's children were classified as the learning poor and unlikely to reach adulthood with basic numeracy and literacy skills. And an additional 10% have joined them due to the pandemic. So from the MHPSS lens, why is education so important beyond the fact that it's a fundamental human right? Education, particularly girls' education, is one of the most powerful tools for creating economic growth, for decreasing the likelihood of conflict, and for fostering resilience. And whether it's in the context of conflict or climate-induced disasters or migration, quality education in emergencies enables children to survive and thrive at times of great uncertainty and great vulnerability. And quality education bolsters children's resilience amidst adversity, supports their socio-emotional and cognitive development, and provides that safe space that is a critical platform for other life-saving services, such as protection services, also potentially as an entryway to health services and mental health referrals, child protection referrals. So in the long term, education can break the cycle of violence and conflict, and it can be harnessed to improve child, household, community, and system capacities to prepare for, manage, recover, and improve from shocks and stressors. But not all are able to access these benefits of education. Rather than being a leveler of experience, COVID is magnifying disparities. So the closure of schools is not only preventing children from learning and enjoying all the other benefits that education provides, but it's also exposing children to increased risks such as child labor, early marriage, trafficking, malnutrition, as well as putting households under more stress. And in humanitarian contexts, that has meant that the delivery of education in emergencies has become more serious and more urgent and more complex to address. I think this quote from the experience of the Ebola outbreak should be sounding an alarm. It really says, this is by Amel Karbul, the CEO of Education Outcomes Fund. Alarm bells should be ringing, especially on behalf of the most vulnerable. The Ebola outbreaks in West Africa saw the number of girls out of school almost treble from 8 to 21%, many of whom became teenage mothers, outlawed from returning to school. As we stare down the barrel of prolonged economic crisis due to COVID, there's a very real risk that by failing to act now, we will be destroying the life prospects and productive capacity of an entire generation. So really, I think what we're looking at, it's not just an education catastrophe, it's a human development catastrophe. As of November 2020, almost 200 million children remain out of school due to COVID. SAVE is estimating that up to 50 million children are at severe risk of never returning to school. The girls, children with disabilities, children who are displaced, and poor children are most at risk. And what we have to understand is that school is a lifeline for so many children. When home isn't safe, school is protection. When they're hungry, school provides food. And when they're living in poverty, school is hope for a better future. So we really do need to look at fundamental within this being a development catastrophe is how mental health and well-being influence and are influenced by all of these areas on the slide: protection, livelihoods, health and nutrition, that hold within them the social determinants of optimal development, optimal health, mental health, productivity, and peace. I'd like to go now to the Save the Children Global Survey, the hidden impact of COVID-19 on children's education, and really to highlight the intersectionalities of education and well-being among these different social determinants. SAVE launched this global survey to find out the impact of the pandemic on the access to children and parents and caregivers to healthcare, education, family finance, and safety. You can see on the slide, it was a very big survey, 46 countries, and huge response rates. I'm going to be sharing within this the sample that you see on the right as number 1 that was done with program participants. You can go to the full report to see the impacts and needs of children by region, age, gender, disability, minority group, indicators of poverty, and more. So just to jump forward, starting first with health and nutrition, as a result of deprioritizing non-COVID related healthcare and lockdowns and fear of contracting the virus, it's predicted that many more children will die from preventable causes during COVID. And food and economic insecurity are also threatening children's access to good nutrition. Malnutrition rates are expected to rise. So healthy development and learning are inextricably linked with health and nutrition outcomes. And we also know that when we integrate MHPSS within feeding programs for young children, that increases the positive impacts on the nutrition outcomes. Let's move to child poverty and social protection. This has quickly developed, of course, into an economic crisis. And SAVE predicts that the number of children living in poor households could increase by as many as 117 million. And we see that 82% of poorer households reported a loss of income during COVID. So as well as being a key factor in undermining economic growth and social capital, child poverty stops children from having access to vital services, and that includes education, and makes them at higher risk of violence, including child labor and child marriage. All of this contributing to adverse child experiences. Going to violence, protecting children from violence, 32% of households in the survey had a child, parent, or caregiver that reported violence in the home. And that was compounded by income loss. Income loss and school closures heightened violence, and this was shown in the report. And violence reported by children was double the rate when schools were closed compared to when school was open and the child was attending in person. So school closures are having a big impact on violence and all of the mental health impacts of that. And girls are disproportionately affected here. I'd like to come down to the specific education results in the survey. More than 8 in 10 children felt that they were learning little or nothing at all. I think that's quite a striking figure. You have 92% of children reporting that their school is closed and very few feeling that they're actually learning. And in terms of disruption, SAVE is predicting that at least 10 million children are not returning to school, with girls and the most marginalized and deprived children being affected. Interesting to this also is that the proportion that felt they were learning very little was higher for children in poor households. Here we can see in terms of access to learning materials that fewer than 1% of children from poor households say they have access to the internet for distance learning. And this is despite the fact that more than 60% of national distance learning initiatives are relying on online platforms. 1 in 4 children didn't have access to any learning materials, and 1 in 4 parents and caregivers could not support their children's learning at all. And 67% of children had no contact with their teachers at all. And this also becomes important because contact with teachers has been found to be very protective for learning, but also for well-being. In terms of obstacles to learning, 40% of the children from poor households reported needing help with schoolwork, but no one to help them. And you can see on the right side of the slide the reasons why there were these obstacles. I'm going to jump down now to the link between education and the mental health and psychosocial well-being outcomes. The vast majority of children who stated that they do not go to school or whose schools are closed reported an increase in negative feelings. That's feelings of anxiety, worry, sadness, 81 and 84%, compared to just over half who were going to school in person. So those are the statistics, 81 and 84 who were not going to school or whose schools were closed. And parent and caregiver engagement is very, very important. I just have a small point on the right of the slide about caregivers interacting with children, particularly for early childhood learning and development. And yet 14% did not report engaging in any activity with their child. This next slide just gives a bit more detail on the comparison of school closures and the proportion of children that report negative feelings. And in this slide, we see the proportion of parents and caregivers that report an increase in the children expressing negative feelings by length of school closure. So you see that sharply increasing at 17 to 19 weeks. And then the next slide, you can see the significant association between, although there was no significant association between weeks in lockdown and signs of distress reported by parents and caregivers, there was, as you can see in this slide, significant associations between the length of school closures and the signs of distress. And you can see sleep changes, changes in appetite, how the child handles emotions, and more aggressive behavior, all rising as schools are closed. So just to sum this up, When we marry these different pieces of data that I've talked about, and we consider even our own lives, the lives of our children and families, we can see the intersectionality of impacts. And what we have is a perfect storm, exacerbating an already dire situation that's caused by conflict, climate change, migration, and displacement. And if we are going to build restorative, effective, and sustainable education, we must view quality education as encompassing well-being and not just academic achievement. And well-being means that we have to address all of these social determinants holistically. We have to reduce stigma and talk about mental health issues. We have to strengthen mental health systems and social protection. This means workforce capacity development in child mental health care and psychosocial support. And we must strengthen mental health systems working toward universal health care and mental health parity. And very importantly, we have to think about teacher well-being and parent and caregiver well-being, including parents with disabilities, which is also inextricably linked with social protection and economic stability. So really what we're talking about is mainstream and integrating against mental health and psychosocial support across health, protection, and education. And I do believe that this is a beloved community issue, a global beloved community issue, if we want to see these impacts. This beloved community that raises children and nurtures them into adulthood. And I believe my colleagues are going to take this forward and talk more practically about the intersection of these parts in their work and in their ideas. Thank you very much.
Thank you, Leslie. Thank you very much. Thank you especially for sharing the very latest from your survey, which is not even probably out in the public. Just two things. The point that you made about education, breaking the cycle of violence, I think it's something on a positive note. And so with that, I think we can go into, like you suggested, some solutions. So we do have some excellent learnings, experience from countries in the region, how going back to school itself can be an opportunity for addressing these issues. So over to Stephanie now. Stephanie is child protection specialist with the UNICEF regional office with over 13 years of experience working in different country settings, and just the right person to be giving us those experiences from the region. So Stephanie, over to you.
Thank you. So good morning to everyone from me. I'm coming to you from the East Coast of the United States. So Leslie's painted a picture for us that, in all honesty, is really dire. And so the question becomes, what can we do about it? And how can we help teachers? So what I'm going to talk to you today a little bit about is child protection and well-being in the classroom. And there's no secret what the COVID pandemic has brought to us. We are all swirling in a vortex of rumors and misinformation in some cases, social media overload. We've had closures of schools, travel and mobility restrictions. There's physical and social isolation and extended quarantines for some of us, increased tensions in household. And we have financial stress. We've got economic crisis, either ongoing or looming. And we've got people who are worried about getting sick. Going shopping is now no longer, no longer a routine exercise. Now we have to think about it and think about what time of day we're going, masks, hand sanitizers. And so there's just a general stress on the planet in general. And then for kids, we've already heard some statistics about what is happening with our kids. And UNESCO estimates, again, we've got 1.6 billion kids that have been impacted by this. And you hear a lot of people say that we're all in this together. And while that's true to a certain extent, we're all in the same storm together. We're not necessarily in the same boat together. We have some people who are experiencing these COVID lockdowns on, as I would make the analogy, on virtual yachts. And then we have some people that are barely making it in canoes or kayaks. And then we have some people who are treading water and without life preservers. And so, yes, we're all in the same storm, but we're certainly not all in the same boat. And in addition to the impact of COVID, we've got two other pandemics that we're dealing with, a possible mental health pandemic. And Leslie's already alluded to the fact that there's a lot of people experience a lot of negative emotions, having a lot of negative psychological experiences right now. But we've also got what's been referred to as the shadow pandemic. And this is the violence in the households that's being reported the world over. And so not all children are experiencing the quarantines and the isolation in the same way. That said, the vast majority of children will be resilient. They will emerge from this, hopefully, with the ability to move forward and to learn and to function and to get jobs and to basically be part of the fabric of society again. But for kids, this is a factor. A child's ability to do this is a factor of multiple variables: socioeconomic situation, age, culture, gender, and previous life experiences, and which influence the way a child perceives and reacts to stressful events. So what can we do about it? So UNICEF took a look at the resources that were available for teachers. And the reality is that not all of our school systems around the world are function within the context of a child protection system. So not all teachers come to the classroom prepared for psychological first aid or with a comprehensive understanding of what the impact of violence does to a child mentally and physically. And so taking this into consideration, it begs the question of what can we do quickly in low resource environments that will get teachers up to speed with how to handle COVID in the classroom. And so UNICEF designed a teacher preparedness training package that's now been made available online and been contextualized in a number of countries across the Middle East and North Africa. And it's basically a 3-module self-teaching guide that addresses safe school operation, which is the parameters of how to operate your school during COVID, social distancing and hand washing, a second module on well-being and protection, and a third module on back to learning, which is really designed to help teachers and school systems rethink academic benchmarks. The module that's critical to what we're talking about today is actually the psychological first aid module, well-being and protection, which is basically grounded in a very simple process of look, listen, link. You don't have to be a psychiatrist or a psychologist or even a trained counselor to be able to provide students with psychological first aid. So I talked to you a little bit about what's coming back to the classroom or what might come back to the classroom. And Saji had made some reference to statistics in his opening remarks, but it's estimated that about 1 in 10 people live with a diagnosable mental disorder. In layperson's terms, this looks categorized as anxiety and depression. But by 2030, we expect that depression will be the leading cause of disability globally, and it's already overtaking cardiovascular disease. And you can see from the statistics, 20% of adolescents globally experience a mental health disorder. It's estimated that between 15 to 23% of children live with a parent who have a mental disorder. 50% of mental health conditions start at age 14. And then, of course, the reference to suicide, which Saji has already made reference to. And these are statistics that are part of a relatively stable population. This is an overview of a stable population. These statistics go off the charts when you start looking at populations affected by conflict, prolonged conflict. Which brings me to the Middle East. So UNICEF recently published an adolescent health dashboard. I encourage everybody who's on this session to take a look at the adolescent health dashboard. But you can see in the Middle East that mental health issues are prominent in terms of causes of disability adjusted life years, particularly for girls and boys in the 15 to 19 age group. And then, of course, for girls, you also see migraines appear, and there are a lot of questions about whether or not the migraines are another symptom of a mental health situation, or grappling with a mental health situation. And then we move to, so that paints the mental health picture. Now we move to the shadow pandemic, and we've already seen some statistics that the lockdowns have created some situations at home that are not healthy. If you were living in an unhealthy household before the pandemic, it may have gotten more unhealthy. And if some households are experiencing adverse stress, having adverse reactions to the pandemic, and may have been perfectly fine before the pandemic, and now there may be an escalation of violence. So we've got increases in sexual violence, including family sexual abuse, sexual exploitation. We've got increases in the number of suicides attributed to incest, sexual abuse, harassment, and rape attempts. We've also seen an increase in hotline and helpline activity the world over, but we've also seen a decrease in hotline and helpline activity. And of course, any protection assistance that was delivered through traditional face-to-face channels are down because social workers are not having the same face-to-face interaction. Teachers are not having the same face-to-face interactions, and medical professionals may not also. And to add another dimension to the discussion on violence, UNICEF carried out a statistical survey to study violence against children in the MENA region using multi-indicator cluster surveys and demographic household data as sources of information. And we've pretty much determined that 85% of children aged 2 to 14 experience violent discipline at home. And this is pre-pandemic information. So you take all of that information regarding mental health and all the information on violence in the household, and you add to it this, now we have kids at home who are spending a ton of time at home and a ton of time on the internet. And while they may not all have access to the internet, the children that do have access to the internet and that are spending hours and hours on it are now even more exposed to some of the I should say nefarious activities on the internet. So we've got more exposure to violent images, we've got more exposure to cyberbullying, and more exposure to sexual exploitation and abuse. So this brings me back to the teacher training package. The teacher training package is, so we'll start with, the United Arab Emirates was actually the first country to contextualize the teacher training package. And so far, over 2,000 teachers, nurses, and social welfare officers have been trained in English and Arabic. And it's also been made available on the Ministry of Education training platform. And the United Arab Emirates also is a pathfinding country under the Global Partnership to End Violence Against Children, and has also signed up to the Safe to Learn initiative. So the fact that the UAE was one of the first countries to take on the teacher training package is a testament and part and parcel to furthering those two latter agendas, pathfinding agenda and Safe to Learn. In terms of what's in the package for teachers, as I mentioned, this is heavy emphasis on getting teachers up and running to deliver psychological first aid to students, but also to better take care of themselves. The overwhelming burden on teachers, it was overwhelming before the pandemic, and parents, I think if they didn't understand that before, they certainly understand that now. But preparing teachers to prep their classroom, their students, work with parents, but also take care of themselves. And the package is designed to be self-taught, and you have two avatars in the UAE. The avatars are Sarah and Hamdan, and they take the teachers through understanding violence, understanding COVID, how to manage COVID. They engage in practical discussions with tips on what teachers have control over, what they don't have control over. Teachers can review the modules at their own pace. There are moments for reflection. there's a lot of encouragement to discuss the content with other teachers. And importantly, there's also a heavy discussion in here about if you do encounter a child with acute protection concern, either a mental health concern or a violence concern, do you have the resources available at your fingertips and the referral mechanisms that you need in order to be able to ensure that that child is referred to someone who can manage that child's issues? We want teachers to engage, but teachers cannot solve all the problems in the world. And we also need to acknowledge that limitation, and they need to have persons in their protection paradigm to whom they can refer children and to whom they can look for guidance. And that's me, a bit rushed, but I'm finished now.
Hi. Hello, everyone. This is Ananda Galappatti. I'm afraid that we have only about 7 minutes left, so I'm going to jump straight in and share a few points, given that we need to rush through. So I work for a platform called MHPSS.net, which is essentially you think of it as a Facebook for people working in mental health and psychosocial support in emergency settings. And one of the things that we noticed, because we collect materials from around the world for sharing amongst professionals, is that there was an explosion of interest in MHPSS related content during the COVID-19 response, something we'd never seen before. We had over 100,000 visitors a day to our site, and we saw this explosion of production of new content. So within months, I think within 6 months, there was 850 different resources, guidance, manuals, literature reviews, articles, etc., on MHPSS in COVID-19. And this is not even counting blogs and videos and other shareables. So we've been curating that content, and one of the things that we noticed was that there's also been, not necessarily quite as extensively, but also notably, material developed adapting existing content around MHPSS for emergency settings and educational contexts, but also COVID-19 specific content. I'm afraid my slideshow is not showing, but I'll just show you here just the slide I would have shown you of some of the excellent resources that have been produced at a global level and also regionally around what you can do to support teachers, learners, and also parents and other caregivers in the context of either lockdown, homeschooling, or return to school. And you can find these resources on at ine.org or on mhpss.net. I thought that I'd just take the remaining time I have, which is about 5 minutes, to share 4 key points from the context of my perspective as a practitioner and also parent of 3 school-going children living and working in Sri Lanka, which has had a long history of MHPSS responses in educational context in response to various serious crises over the past 30 years. So the 4 questions that I want to ask are, how do histories of crisis, past experiences of war, tsunami, bombings, etc., impact capacity for adaptation and response to COVID-19? I also want to talk about maybe what some of the challenges to integration of MHPSS in educational settings have been, some of the variability of access to support for home-based learning, and how, perhaps I'll skip the last one because I've just been told I have 3 minutes, which is the point that Leslie was making around the need that MHPSS for education has to mean more than what we are currently doing only in schools, and it needs to go beyond the classroom. On the matter of how impacts of past or multiple crises either build resilience or exhaust capacity, Sri Lanka had, so due to the long-standing war and tsunami disaster of 2004, it has had decades of training and development of systems. We've had lessons learned written about education emergencies work in Sri Lanka. And then yet from that period, in the last decade, there hasn't been significant crisis, except last year we had the Easter Sunday attacks which resulted in school closures and a lot of widespread panic. And then, of course, this year, COVID-19 from around March this year. And what we've seen is that the crises of the past helped us to make certain changes in terms of, for example, bringing in school counselors into the formal education system where they didn't exist previously. But at the same time, we've seen that capacity is not always retained. That there have been changes in personnel and policies over the years with governments changing, and the responses essentially are the capacity to respond to the new crises of the bombings or the current COVID context sometimes involve almost starting from scratch. There's been degrading of skills and knowledge over time, and also the exhaustion of dealing with crisis after crisis. And this is something that we also hear from other crisis contexts. On the issue of, I've got a minute left, so on the issue of the challenges of integration of MHPSS into education context in COVID-19, one of the things that we've noted is that educators, including administrators, need more than brief guidance. They need how to do things day in and day out. There needs to be adaptation of MHPSS content or considerations for local systems and structures into appropriate lessons across grade levels in the local curriculum. So even if there's global content or regional content available, it needs to be revised, extended, and contextualized. And this reorientation or doing things differently requires technical resources, time, and there are limits to what is possible in the context of a pandemic. We need resources, we need political will, and we need also, unfortunately, pre-existing capacity. I think my time is up there, so I'm going to just stop and hand it back to Saji. Thank you.
Thank you, Ananda, and thank you all the speakers. We have a dire situation, we have solutions, we also have resources. Unfortunately, that's all the time we have, but I'm sure there'll be a lot more opportunities for us to interact and share resources. Thank you very much, and have a good day, good evening, and rest of the day. Thank you very much.